Assalamu alaikum. It's a video station, and in the video I can see a 5 days old neonate in hospital situ with orchestic tube, umbilical catheter in situ, and the child has no dysmorphic face, alert, and seems to be well grown for his age. However, I want to do the anthropometry, and in hospital settings I can see there is symmetrical rapid shaking movement with equal amplitude in all limbs, and which is subside by holding of the limbs. So considering all, my differential diagnosis, it can be jitteriness, it can due to hypoglycemia, hypocalcemia, hypomagnesemia, shivering due to hypothermia, it can be seizure. So what history? History may be onset, course and duration, and frequency per day, feeding history, detailed perinatal history, gestational age, maternal history of diabetes, any history or risk factor for early onset neonatal sepsis, maternal fever, and then what examination, airway, breathing, circulation, vital signs, and then cardiovascular system examination, all the reflexes, examination of the genitalia, and gestational age measurement by ballot scoring, modified ballot scoring, and also doing the anthropometry, and also seeing for the reflexes and looking for any apparent congenital anomaly present or not. And then what investigation? So, suppose it's a case of hypocalcemia, so any history of so the investigation, what may be the causes if it's a case of hypocalcemia? Prematurity is itself a cause, IUGR, IDM, hypoxic ischemic encephalopathy, hypomagnesemia, hypoparathyroidism, DiGeorge syndrome, maternal hyperparathyroidism. And investigation in case of neonatal hypocalcemia. So investigation: serum calcium, preferred ionized calcium, serum magnesium, phosphate. And if there is persistent hypocalcemia, so renal function test, liver function test, ALP, parathermone level. And if we suspect it's a case of DiGeorge, so chest X-ray, thymic shadow may be absent, echocardiography, and genetic testing. And then management, how you manage if the case is hypocalcemia. So if there is only hypocalcemia and patient is asymptomatic, so nutritional support with calcium supplementation and IV fluid with calcium. But if patient is symptomatic, such as patient has apnea or seizure, so IV 10% calcium gluconate. If it's associated with hypomagnesemia, so magnesium supplementation. If vitamin D deficiency is present along with it, so vitamin D supplementation. And then subsequent management, we will monitor the bone profile and the phosphate level. If the calcium level after 48 hours become normal, so the maintenance therapy of with calcium. But if fail to normal after supplementation, so treatment of the underlying cause. So how you can differentiate jitteriness versus neonatal seizure? So in case of jitteriness, it will be subside by holding or flexion of the limbs, but in case of seizure, it needs medication. And vital instability found in case of seizure, where jitteriness vital will not be changed, and autonomic changes in present in case of seizure, eye deviation presence in case of seizure, and neurological examination will be abnormal with the seizure, whereas the autonomic chain ID ratio neurological examination will normal in case of jitteriness. Thank you.